Have your knees been barking at you when you squat, run, or jump? And you're probably tired of doing step-ups instead of box jumps, skipping out on squat days, or resorting to having to use the bike instead of getting outside to run. I bet you feel like you've tried everything by now, and you want to avoid ice packs every day, and pills, and injections, and long periods of rest. So stay tuned, and in this video, we're going to discuss some of the common causes of knee pain, show a quick assessment, some rehab exercises, and a brief shot of what an in-office treatment might look like.
Hey, Dr. Jake Shockey here. So what we're going to talk about here is just a quick exam and assessment for knee pain. So the first thing we're going to do with any type of knee pain is going to check, obviously, the knee, but we're also going to look above at the hip and below at the ankle. So to start with, we're going to have Mr. Jones here step up onto our 6-inch box or stack of plates to about 6 inches. What we're doing here is checking for hip control. So we're going to say, Mr. Jones, please, as you're standing up there, drop your left heel to the ground. And as he does that, we're going to ask him to do it 3 or 4 times, and we're just going to check for hip control to make sure that his pelvis is staying level. We're going to check the right knee to make sure that it's not collapsing inward. And we're going to look at his right ankle and overall balance and control. Then we're going to say, Mr. Jones, looks good. Can you switch sides for us, please? And do the same thing on your left leg. So here we're also going to check all of the same boxes as well as checking symmetry from side to side. So as long as this looks the same from side to side and he's showing overall good control, we can start to rule the hip out of the equation here. So Mr. Jones, come on back to our table. So from here, we're going to continue looking at the ankle, but instead of actively doing something, I'm going to palpate his ankle here. So we're just going to check for overall ankle dorsiflexion. Bend your knee. We're going to check for midfoot dorsiflexion and calcaneal eversion. So we're going to do the same thing on this side and just check for midfoot dorsiflexion, ankle dorsiflexion, and then calcaneal eversion. With that too, we can also check big toe dorsiflexion to make sure that he's getting enough dorsiflexion there and that it's symmetrical side to side. So now that we've kind of all but ruled out the ankle, the hip, we can start to look a little bit more specifically at the knee. So what we're going to do is a few of the tests here for the knee. Not one of these is going to direct us towards exactly what's going on, but if they start to show trends and we start to see that he's checking off multiple positive tests for a specific part of the knee, then we're kind of onto something. So based on the history of the injury, or if this is just kind of pain when we're squatting or something like that, things might look a little bit different. But the first thing we're going to do is just rule out the ACL and the PCL. So we're going to have the patient in this position here, and we're going to just support the back and then just try to push the tibia posteriorly on the femur. So we're checking the integrity of his PCL there, and then blocking his foot, I'm going to pull and try to pull his tibia towards me off of his femur. So if there was a lot of laxity there, then we would potentially have an ACL issue. So the next thing we can do is get him into a slightly less flexed position. I'm going to support his femur and then again try to shear that tibia on his femur. So shear it posteriorly, checking there and there. So the integrity of the ACL and the PCL can be checked doing those tests, and then we're going to move on to the meniscus. So with his meniscus, we're going to first ask, Mr. Jones, do you have any tenderness here near the joint line? No. So oftentimes with a meniscus injury, we're going to have joint line tenderness. There's going to be clicking, popping, especially with going upstairs, jumping, running. Oftentimes it might feel like your knee is going to give out or buckle, or it could get locked up. But some tests that we can do is just palpating here right at the tibial tuberosities and in the knee, And then we're going to internally rotate the tibia and then bring him down here, listening for any clicking, popping, or signs of pain. So with external rotation of the tibia, we're checking the integrity of the lateral meniscus, and then vice versa. When we externally rotate the tibia and bring it down, we're going to check the integrity of the medial meniscus. So if any of those signs were pointing towards positive meniscal injuries, we would pair that with any of our other questionings or other exams. So we're going to do one more check for the meniscus. Mr. Jones, can you please stand up off the table? We'll have him stand here, and then he's going to hold on to my hands, so he's going to face me. We're going to go on one foot, and all we're going to do is just have Mr. Jones try to rotate in and out on that leg. Any pain? No. So Mr. Jones might be faking this injury, but in all seriousness, this is a pretty good test for any type of meniscal injury. If he was to have done that test, said, yes, I do have some pain, especially when I go in or when I go out, that would lead us further down the lines of a meniscal pathology. Last, Mr. Jones, can you come back to our table here and laying on your back? The last thing we can do here is just check overall joint range of motion. So what we can do here is bring the knee up, and we're just going to try to flex it in as far as we can, and then compare that to the other side. So we would do one side, compare it to the other, and then we can check for extension of the knee as well. So we're checking flexion and extension of the knee. You could get into a little bit more specific range of motion tests, doing internal, external rotation, and things like that. But flexion and extension is what we're going to focus on today. And obviously, with an exam or an assessment, it can be very, very deep and in depth, and we could add on just test after test after test. This is just a quick kind of overall basic guideline for what an assessment or an exam would look like for somebody who came in with knee pain. All right, so let's talk about a little bit of what treatment would look like for somebody who came in with a knee complaint. After assessing and examining the knee, and we've determined exactly what treatment is going to look like, we don't have to do all of these things. And there's much more that we could do, but this is just a quick kind of little taste of what could potentially be used as treatment. So in our assessment, I forgot to mention earlier that we also want to check for tone and tension here in the quads or even in the adductors. Oftentimes adductor trigger points or even quad trigger points in the vastus medialis or rectus femoris, even vastus lateralis, especially like in certain populations, can often lead to knee pain. So we have the option of either doing some ART or even dry needling in those areas, and oftentimes that can clear knee pain up pretty quickly. The next thing that we can do is do an adjustment on the actual knee. So using our speeder board, we can adjust. We don't need as much tension here. But what we're going to do is throw that under the knee, and then determining which way we need the motion. So if we need more internal rotation here, we can just take the knee there, internally rotate, and give him a little adjustment there. So we can go through that. Or maybe he needs external rotation of the tibia. So you can just continue going through those ranges of motion that he needs. Obviously, with this whole knee complaint, we're going to constantly be checking, monitoring the hips and the ankles, so we can go and adjust the feet, the ankles, the actual knee, the hips, the low back. All those things are going to contribute to how the knee is working. Oftentimes, a knee injury is not specifically a knee injury unless there's specific trauma to the soft tissues. Otherwise, knee pain is usually because somewhere else is not functioning properly. So we're going to continually be monitoring that as well as the actual knee complaint. So the last thing that we're going to show today is one of our DNS positions in our hanging position. So Mr. Jones, come off the table here and we'll get you set up. So what he's going to do is bring his right leg up onto the table and then we're going to coach him through. So bring this right there. So what he's going to do here is kind of open and spread those toes as wide as he can. We're going to encourage him to kind of keep that weight evenly spread throughout his foot without scrunching the toes or clawing or gripping the ground with his toes. So what we're looking for here is just proper centration of the movement of the knee joint with some motion. So this is a little bit more of an advanced position, but we're basically saying that he's done some of the basic rehab. He's kind of gotten to the point where we just need to start stabilizing this knee and controlling it with some movement. So what we're going to do is just have him place his hands together out in front, and then I'm going to give him a few targets. So he's going to reach forward here, bending at the knee, coming forward to touch here. So what we're looking for is just making sure that that knee is functioning properly through the various reaches. So if for some reason we see that the target is over here and he collapses in there with his knee, well, oh, Mr. Jones, that looked like it hurt. So you can see he showed us what a lot of quality reps look like. We saw one bad rep. If a patient has no control over their hip or their knee or even their ankle, we probably wouldn't get to this exercise yet. So most likely, if a patient's in this exercise, they're on the right path. But nevertheless, we're going to continually be monitoring that knee and how it's moving and working. So those are just a few options for treatment. Keep watching, and we'll go over a little warm-up that you can take with you before you work out or get into a sport.